Good morning, Dr. Caldwell.
Good morning.
I'm Ashley Tinch.
Nice to meet you.
Nice to meet you. I'm going to do a head-to-toe assessment on you today, if that's all right.
Sounds good.
Okay. I came in the room. I'm going to do hand hygiene. And I'm going to provide privacy for my patient. For purposes of this exam, we'll just keep you all the way clothed, if that's okay.
That's great.
So I'll just move your shirt as much as I need to, but with the privacy, I think you'll find that it's private. So her overall appearance is well nourished. Her skin is normal for ethnicity. She's sitting upright in bed. She looks well groomed and well nourished. She is able to move all of her extremities. I watched her walk in and her gait was normal. Her mood and affect is appropriate and she's pleasant overall. And she has the ability to hear and speak because she's responded to me already this morning. So I would ask about her level of orientation. So what's your name?
Megan Caldwell
And where are you today?
at South College in the Fake Hospital.
Okay. And what year is it?
2019.
Perfect. So she is alert and oriented times 3. So we'll go into her head and face. So what I'm going to do is I'm going to actually touch your head if you're okay with that. So I'll start with inspection and just look at her head. It's normocephalic. Her hair is smooth and shiny. And I'm going to just palpate on her scalp. Everything looks nice and normal and there's no dryness noted in her scalp. Her facial expression, so now I'm going to ask you to do some funny things. Are you ready?
Mm-hmm.
So puff your cheeks for me, smile, frown, raise your eyebrows, shrug your shoulders, stick out your tongue, and move it side to side. Perfect. So cranial nerves 7 and 12 are intact. I'm going to touch your face. So I'm going to feel here. Any pressure, pain?
No.
Here?
No.
So maxillary and frontal sinuses, there's no pain or tenderness, so that's all normal. I'm going to move down to your eyes. So the first test I'm going to do for your eyes is the visual fields by confrontation, and it tests your peripheral vision. So what I want you to do is to cover this eye with this hand, and I'm going to do the same. And I want you to tell me when you can see you're going to look straight at me, and then you're going to tell me when you can see my hands peripherally. Okay, good. And then we'll switch eyes. Good, and so her peripheral vision is intact. That's excellent. Now we'll do the 6 cardinal fields of gaze. So if you would, just watch my pen light. Good. And then go. Very good. So the 6 cardinal fields of gaze are intact in all the positions. I'm going to look at your pupil size. So just look straight ahead. Good. And can you look in the distance? And then look back at my pen light? Perfect. So I would say that this patient has Perla. So her pupils are equal and respond to light and they accommodate, which is perfect. I'm going to look with my light source at her eyes. So her conjunctiva is clear. Good. So her conjunctiva sclera, corneas, and irises are all clear without lesions or exudate, which is excellent. We'll move down to your ears. I'm going to inspect the outside. Any tenderness? Nope. And I'm going to feel your pre- and post-auricular lymph nodes, and they're not palpable, which is normal. No tenderness noted into external ear. I'm going to look with my light source just on the outside. There's no cerumen in the ear canal. There's no drainage, no lesions on the outside of the ear. Palpated your lymph nodes already. Your ears are symmetric and aligned normally and intact. Okay, so and then can I have you open your mouth, open your jaw and close? Good. So your mastoid process, no lesions and no pain there either. I'm going to look in her nose, so just lift your nose up. Good. So the turbinines are pink and without drainage. I'm going to test the patency of your nares. So if you would just cover one, breathe in for me. Good. And then switch. So both nares are patent, which is also normal. I looked at your mucosa already and they're pink. No discharge. We'll look at your mouth and throat. So I'll look at the outside of your lips. Your lips are smooth and moist and pink, which is normal. Now look inside your mouth, please. Say ah. I call her tonsils 1+. The inside, her tongue, her buccal mucosa, teeth, and gums are all smooth, pink, without dental caries. Hard and soft palate are intact and also pink, and the tonsils are 1+. And she said, so her uvula and soft palate move and are intact. So now we'll move down to your neck. So I'll start to feel your lymph nodes. Lymph nodes are non-palpable, which is normal. Her neck is symmetric. I don't notice any lumps or pulsations that are abnormal. I'm going to do your thyroid. I'll just walk around this way. Do you think you can swallow?
Mm-hmm.
Okay, so I'll have you swallow. Okay, and I don't feel a thyroid at all, which is normal. Coming back around. I'll inspect for venous distension in this position. I cannot appreciate any venous distension on either side. I'm going to auscultate for bruise. Take a deep breath and hold it. Perfect. Let it out. On the other side, take a deep breath and hold it. Good. So I don't appreciate any bruise at all. I'm going to feel your carotid pulse, one side at a time. And it's intact. I'd call it 3+ on both sides. Now we'll do your range of motion of your head. So if you would, just go one side to the other, in front and back. Perfect. And now you'll do it with me pushing against you. Can you push against my hand? Perfect. And back. And one side and the other. Good. So range of motion is intact, and she has even and equal strength in all directions. So now we'll move down to your chest. We'll inspect your chest. Everything looks symmetric and normal. Skin looks intact, no lesions, normal for ethnicity still on her chest and arms. Her AP diameter is 1 to 2, which is what we would expect for her. Let's see. I'm going to feel your shoulders and just palpate down your arms. So again, symmetric, no lesions, no bumps, and no pain.
Nope.
Okay. Can you lift against my hands? Perfect. So that's strength, and her shoulders was equal. Now we're going to listen to breath sounds. This is going to take a minute because I'm going to listen 6 places on the front, 8 places on the back, and 3 places on either side. Okay, so just breathe normally for me. And I'm going to listen one side and then the other to compare. One side, then the other to compare. So that was 6 on the front, and I'll listen to 8 on the back. And then 3 on either side. So good. Good. So all breath sounds are clear and equal in all of the places that we listened, in all fields. So now we'll move down to the heart, and I'm going to listen to your heart in 5 different locations as well. So again, just breathe normally. Okay, so the rate is regular. Rhythm is regular rate and rhythm, and there's no splitting. S1 and S2 are present, no S3 or S4 or murmurs noted. So that's normal. And now we'll go to your abdomen. So if you would, just have you lay back. We'll keep you fully clothed for this. From what I can see on the outside through her shirt, everything looks symmetric as far as her abdomen goes. Her coloring is the same throughout and smooth and supple. There's no lesions and there are no visible lesions or lumps. So the next thing we'll do is we'll listen for bowel sounds. So bowel sounds are normal, active in all 4 quadrants. And next we'll palpate, okay? So I'm going to palpate lightly first and then it'll be a little bit deeper and I'll warn you. So I'll just palpate in all 4 quadrants. Now a little deeper. Any pain, tenderness? Okay, so no lumps, and I don't know, and there's no tenderness present, so that's all normal. Excellent. Let me make sure I got all of that. Yeah, no masses. Said that. Okay, can I have you sit back up? We'll do more neurologic stuff, so just sit this way. Now we'll test your cerebellar function. So if you would do, touch your finger to your nose and then to my finger as fast as you can. Faster. Good. And then you'll do rapid alternating movements. So what you'll do is you'll put your hands on your lap. You'll flip them over really quickly. Excellent. And then can I have you put your heel on your opposite shin and go down? And on the other side, heel, opposite shin, down. Perfect. So cerebellar function is intact. All those tests were normal. So now we'll do light touch sensation. If you would, just close your eyes. And when you feel me touch you, just say yes. It doesn't matter where. Just say yes.
Yes. Yes. Yes. Yes. Yes.
Yeah, so her light touch sensation is intact in all those areas, which is excellent. The next thing I'll do is I'll have you move a little bit. So if you would, just start at the wall, and I'll have you walk normally just to the curtain and back. Perfect. Now can you walk on your heels to the curtain? Nice. And then walk on your toes on the way back. Perfect. So her gait is normal, and her musculoskeletal system seems to be intact. Let me have you turn the other way around, and then you'll bend over, and I'm just going to look at your spine. So her spine and her back is all symmetric, and I'm going to look at it this way, and there's no nothing elevated on either side. Perfect. So you can stand back up, Megan. And then the one last test is the Romberg, so I'm just going to have you stand here and close your eyes, okay? She didn't have any swaying at all, so that's a negative Romberg's test, which is exactly what we want in normal. So you can sit back down. Is there anything else I can do for you today? Your assessment was grossly normal.
Perfect.
Okay, thank you so much.
Thank you.